Good morning from wherever you are, and thank you for attending this webinar. My name is Beth Njeri, the Digital Content Officer at World Animal Protection. Today, we focus on the use of antibiotics in farm animals. Globally, there's been an influx on the use of antibiotics in animals, and this has had a severe effect in animals and people. Leading us in this discussion is Dr. Victor Yamo, the Farming Campaigns Manager at World Animal Protection. Victor is an animal welfare enthusiast with over 20 years experience in farming systems. Throughout this presentation, he will take us through the reality of antibiotics use in farming systems and what you can do to ensure improved consumer choices. Let's take this conversation global through the hashtag Animals Matter AF. Our Twitter handle, as you've seen in the previous slide, is at Move the World AF. Just before we kick off, we'll pop up two poll questions just to gauge your understanding on the use of antibiotics in farm animals. This will be up for about 1 minute, so kindly ensure to select your answers quickly. The results will be shared at the end of Victor's presentation, so please consider sticking around because we'll have a bit of discussion on that. We'll also have a Q&A session immediately after the presentation. So as Victor goes along with the presentation, kindly type in your questions in the Q&A box down on your screen. This time round, and I keep saying this, but this time round, we'll also include a 5-minute audio question and answer session, but that depends on how the webinar moves along in regards to time. Should you have something you'd like to get clarification about, kindly raise your hand and I'll unmute you when the time comes, but that depends again on the time, on how we'll spend our time during this webinar. Shortly after the main session, we'll have a 15 to 20-minute journalist session. So if you're a journalist here and representing any media house, kindly stick around. We'll have an audio session where you'll get to a chance to verbally ask questions to Victor. And after that, we'll now finalize the webinar. So just before we start, like I said, we'll pop up a poll. So please participate. We would like to gauge your understanding on the use of antibiotics in farming systems.
Thank you, Beth, for the introduction. Welcome, viewers, to our webinar today. And what I'll do is quickly run you through the presentation, and then we can have questions at the end of the presentation. So the presentation today is entitled Antimicrobial Resistance Public Poll Results. A use of antibiotics on farm animals, should we be concerned? And I'm Dr. Victor Yamo, the Campaign Manager, Animals in Farming at World Animal Protection, Africa Office. Our agenda for today is, first we'll give a brief of who World Animal Protection is. Then we'll give you a brief of the methodology and background of the poll. And then the poll findings are split into 4 sections: animals, antibiotics used in farming, the threat of a pandemic, what should be done, and influencing change, then conclusions, then we'll have a question and answer session. So who is World Animal Protection? World Animal Protection is a an international NGO that works around animal welfare. Our vision is a world where animals live free from cruelty and suffering. And our mission is we move the world to protect animals. And we, in this case, is not World Animal Protection alone, but all of us, everybody who's engaged with us, our supporters, our stakeholders, the people we work with across the globe. So consider yourself a part of that process. We have 15 offices as indicated there, with the Africa office being located in Kenya, looking after animal welfare issues across the African continent. And we work across 4 campaign areas: animals in communities, which predominantly looks at responsible pet ownership and ensuring that inhuman culling of dogs is not acceptable, but ensuring that we have responsible pet ownership and ensuring that dog population management is done appropriately. We have campaigns around animals in disaster, which look at what happens when animals are in disasters, and campaigns around animals in the wild that looks at animals being used for entertainment and wild animals predominantly being used for traditional medicines. Last but not least, we have animals in farming that critically looks at humane and sustainable agriculture, especially around intensively farmed animals. And that is where we are going to be concentrating today as we go along. So the poll, briefly, the poll was done using by an organization known as FLOOD, which is a London-based market research and insight agency on behalf of World Animal Protection. Its aim was to raise awareness or to look at issues around knowledge and understanding of antibiotic resistance and gain understanding of what the general people out there feel around issues of use of antibiotics in farming. It was also to gauge concerns around human health aspects, especially when we're looking at antibiotic use in farm animals. A total of 15,700 people were polled across 15 countries across the globe. And as I said earlier on, Kenya was one of them. That gives us roughly about 1,000 people per market where we were doing the polls from. So antibiotics in farming, to just go into the poll results and what we found out. The most interesting thing is when we asked people to estimate the amount of antibiotics used in farm animals, only 52% of the the guess that people gave us was that about 52% of the world antibiotics is used in farm animals. However, they were a bit shocked when we actually told them that the actual percentage is 75%. So 75% of antibiotics produced globally is actually used in farm animals. And 82% of the people think that it's under 75%. So clearly we can see that there's a disconnect between what is actually happening and the reality on the ground and what people perceive to be happening out there. The comments around that then clearly shows that there is low level of awareness of the issue. We have comments like this should be shared to all people for them to understand. We have comments like, I did not know that they used antibiotics on farm animals. We have comments like the public needs to be educated about animal welfare. And so generally, that's a good place to start as World Animal Protection, we feel, because people are beginning to recognize the fact that the awareness level at that level is very low and something needs to be done about it. Majority of the people also feel that the use of antibiotics is wrong. And if you look at the slide there, if you look at the Kenyan context, which is at your extreme right, about 85% of the people believe that use of antibiotics is wrong and 15% felt that it was right. The overall tendency, again, which is at your extreme left, is that 84% of the world global population feels that, the sample size feels that use of antibiotics is wrong, which closely mirrors what we saw in Kenya. The older groups and overall females tend to likely say that it is wrong, and that is something that was very interesting to come out with from the polling question. The concern on superbugs or coming from farm animals is not something new, and we quickly have indicated there on that slide some of the headlines that we've been seeing over the last few years. For instance, you can see the new scientists talking about superbug risk from tons of antibiotics fed to animals. We also have the independent talking about the next pandemic might be worse. Scientists are already fighting the next global superbug. And that article quickly talks about antibiotic-resistant superbugs as one of the things that we need to look at. And the Guardian on the extreme left is talking about superbug hotspots emerging in farms across across the globe, as the studies indicates. But if you leave the international press and look at what is happening on the African context, we can also see that the same concerns around antimicrobial resistance is being recorded in Africa. For instance, the Nation talks about stop escalating antibiotic resistance or perish. And that is something that is driving the organization to start looking at antibiotic use and antibiotic resistance and working with the relevant authorities to ensure that the correct thing is done. Voice of America, it talks about Uganda tackles high levels of antibiotic resistance, and science development talks about antibiotic resistance in Africa needs urgent attention. And for us as an African office, that is the reason why we then engage with this process, because we in the African continent need to be part of the solution and be part of the process of ensuring that we eliminate or minimize or reduce the use of antibiotics on farm animals. Coming out of the survey or the poll is the fact that there's concerns around the superbugs coming from farm animals. Almost 88% of the people who are polled were concerned about the possibilities of superbugs coming from farm animals. And in recent years, that has been shown to be part of what is happening because antibiotics are being used greatly in farm animals. And as we already alluded to, 75% of the antibiotics are actually being utilized on farm animals. The concern about superbugs is also related to personal health. And basically 70% of the people are saying that they are curious or concerned because superbugs have the potential of causing adverse effects on their families. The 66% were looking at it from the contamination of meat aspects, and 59% were looking at it from aspects that lead to passing the superbugs into the environment, which then means that if you're on a farm or on a waterway and the contamination or resistant organisms are in the environment, they will most likely get into the food chain. Hence the reason at certain levels we talk about One Health in terms of tackling superbugs and antimicrobial resistance. Concerns about superbugs is also comments around that were received when people are asked to make comments around the study, saying things like, I've learned something unpleasant, perhaps even dangerous, is happening in farm animals. We have also got people talking about the fact that 75% of farm animal use antibiotics was very shocking. I am shocked that 75% of the world antibiotics are used for animals. And so that 75% statistic became a very powerful thing when you're looking at the engagement with consumers, because it's something that they are slowly becoming aware of and they were not aware of when we started off. In terms of the threat of a pandemic coming from farm animals and the use of antibiotics, again, concern has come from, there are various articles that you can look at. The Independent talking about coronavirus, industrial animal farming has caused most of the new infectious disease and risks, more pandemics experts warn. And this is something that has been seen, that the next pandemic will most likely come from intensive farming systems, what is internationally called as factory farms or industrial farms, because of squeezing a lot of animals into small spaces and not catering for the welfare of those animals. And essentially that's why, as an organization, again, we are saying that we need to manage farm animals in a better way to ensure that we are not exposing the global population to another pandemic. In terms of concerns around pandemics, 83% of the people are concerned that there's a possibility of a pandemic originating from farm animals. And especially people who are under 45 years, 85% of them, and females, 84% of them had concerns about the fact that there's possibilities of pandemics coming from intensive farming systems. The concern about pandemics is also very much higher in Latin America, Asia, and Spain, and Kenya, representing the African continent also had a very high recording of concerns, with almost 90% of the people concerned about possibilities of pandemics coming from farm animals. And I think we are in interesting times because of the outbreak of COVID-19 and the fact that people are now beginning to critically assess and understand and appreciate the fact that if we do not manage animals well, then we are exposing ourselves to potential pandemics going into the future. What then should be done? Before we even go to what should be done, then the question would be, where is it coming from? This antibiotic use, what is driving it? The three things that is driving antibiotic use: one is antibiotics has been used as growth promoters for quite a while. However, around about 2006, the year 2006, the European Union discontinued the use of antibiotics as growth promoters. And essentially what happens in terms of growth promotion is the use of small doses or subtherapeutic doses of antibiotics to help the animal grow slightly faster. The reason why that was banned is because of the fact that then you had residues and you are also selecting for antimicrobial resistant organisms. In a recent study that was done by World Animal Protection, we found that 71% of organizations that are part of our membership of World Organization for Animal Health and have stopped the use of antibiotics as growth promoters. However, the important thing is then to say what is happening to the 29%, and where are these 29% countries that need to then be part and parcel of that process? Are African countries part of it? And is there something that we need to do differently? Because maybe the laws and the situation in Africa is slightly different, and the rampant use of antibiotics is something that is still being seen. The second way that antibiotics then get into the food chain is about how we do prophylaxis or metaphylaxis, which is basically administering antibiotics to healthy individuals to prevent infections. And in terms of prophylaxis is where we perceive there's a risk. So because, for instance, in our African context, because we found that our environment is not good, or our management of farming systems is not where it's supposed to be, or the house that we're using is not well ventilated or is not clean because we are not allowing it to rest well enough. Farmers then have discovered, especially small-scale farmers in the African context, has then discovered that if you give antibiotics, you suppress the disease. Unfortunately, what they failed to see is that use of antibiotics as prophylaxis is exposing the human population to hazards that we need to avoid, especially things around antimicrobial resistance. And that is something that we're looking at. Especially as an organization, we are saying that it is important and critical that we ensure that we have high welfare production systems that cater for the requirements of the animal in terms of good, appropriate feeds, in terms of a comfortable environment that has good ventilation, there's good biosecurity to minimize disease, has enough bedding, the animal is comfortable, and and also in terms of ensuring that disease control is apt so that the animal is not being predisposed to diseases that then lead to the use of antibiotics as prophylaxis. And so part of the drive for World Animal Protection is to ask farmers to ensure that we are not part of a poor welfare or low welfare production system, but we're improving our production systems to ensure that they're high welfare. The last way that antibiotics get into the farm is used in farm animals is when the animal falls sick, and then you have to treat it. As an organization, our stand is that animals, when they are sick, must be treated, because if they are not treated, then their welfare is compromised. And so we are not part of the team that talks about antibiotic-free production systems, but we are saying antibiotics are part of the production system, but they must be used prudently. When the animal is sick and requires treatment, proper diagnosis must be made and the appropriate treatment instituted. And those are the three major ways. In terms of treatment, when the animal is treated using antibiotics, it is also critical and important to observe the withdrawal period of the antibiotic. That is to say that every antibiotic or any medical preparation that goes into production system has a period within which the products coming from that animal, be it milk, eggs, or meat, should not be consumed. And that is part of the challenge, I think, in the African context, where we do not observe the antibiotic withdrawal periods. And essentially what then happens is that products with antibiotics or products with superbugs then get into the food chain. And that is something that we need to be critically looking at. Who should then be responsible is one of the questions we then asked, considering that antibiotics are being used in farm animals, and who then should we hold responsible? There were three categories of people that came through. One was farmers and producers. The second one was the government, and finally the retailers or supermarkets. And essentially 71% of the respondents say that farmers and producers need to do things slightly different to ensure that antibiotics are not going into the food chain. Government, 69% felt that government had a role to play, and 28% felt that retailers and supermarkets had something to look at and to ensure that antibiotic use was at the right level. For the producers, close to about 80%, 85% in the Kenyan context, about 83%, realized and identified that using antibiotics for growth promotion is wrong. And I think that is something critical. As producers, we need to start looking at ways of ensuring that we move towards high welfare production systems, which then negate the use of antibiotics as part of the process. And remember that internationally, growth promotion, use of antibiotics as growth promoters has been banned. And that means that we need to start aligning ourselves, especially in the African context, to the global standards around antibiotic use. The second thing that we need to look at is about 85% of the population that was sampled also identified the fact that antibiotics are important and must be used for treatment of animals, especially after diagnosis, the appropriate diagnosis has been made. And that is something that, again, we are trying to ensure that is ingrained into the production system as we go along. In terms of government, there are four things that government was identified for government to do. One was government was supposed to monitor the use of antibiotics at farm level. 92% of the people felt strongly that government should be doing that. 90% felt that government needed to monitor pollution that comes from farms, because part of how superbugs move is if I am disposing manure from a pigsty or a manure from a poultry unit, where am I taking it? In the African context, most likely it is going to go as manure onto my farm. If that manure has antibiotic resistant organisms or antibiotic residues, it means we are contaminating the plants or whatever the environment around which we are working. Government, 90% also felt that government should develop minimum welfare standards for farm animals so that the welfare of the animal is catered for, and in that way then we minimize the use of antibiotics because of a poor welfare situation. And I think that is something that in the Kenyan or countries around East Africa have started looking at. Last but not least, 85% of the population also thought that government should restrict the use of antibiotics. And I think it's something that is important and critical. We are able to buy antibiotics over the counter. In fact, for farm animals, you can buy antibiotics from any agrovet. Antibiotics are prescription-only drugs. Ideally, the farmer should have a prescription from a veterinarian or a competent person who has looked at the animals and has made a diagnosis and then is prescribing the appropriate drugs. That is something that is critical, and in the African context, we need to start laying emphasis on, so that drugs are not just readily available. Several studies done, and we engaged a consultant to look at work done in Africa. Several of those studies have shown that the fact that antibiotics are readily available is part of the reason why their use in farming system is at that high level. So one of the things that government needs to look at is looking at restricting the use of antibiotics and only allow antibiotics to be used for treatment of animals after an appropriate diagnosis and a prescription is given to the farmer. We also said that about 28% of the population talked about looking at retailers, and there were several things that retailers were considered to, were thought should look at. One was retailers were, 93% of the population thought that retailers should ensure that the meat they sell meets minimum welfare standards. So essentially what is happening is that the population or the respondents were connecting the fact that if there were minimum welfare standards that government had done, then retailers would have to follow them to ensure that whatever goes into the retail sector is something that is coming from a production system that meets the minimum welfare standards. The second thing, 92% talked about transparency to ensure customers are able to identify the source of the meat that they're using or being supplied in the supermarket or retailers. And that is something that is important because we need to have a traceability process that ensures that only animals that are coming from high welfare production systems, which are not using antibiotics haphazardly, are allowed into the retail market. And I think as an organization, we have been looking and working with industry around some of these things, and there's a process that we, in subsequent webinars, will be talking about our results around some of that process. Also very interesting is that 85% of the people are talking about retailers need to stop selling meat from farms that use antibiotics. And I think that is something that retailers need to look at their procurement system. Do you have procurement systems that go and audit farms to ensure that the farms are not using antibiotics? And if they're using antibiotics, it is being used prudently to treat animals when they are sick. The whole gist of that, this engagement was then to find out where we can influence change. And several points came out where change can be influenced. The first one was the fact that producing meat from poorly treated animals is wrong. And as we continue in having this engagement and talking to consumers and the general public and raising awareness, our hope is that people will be able to start asking for where the meat or the milk or the eggs that they're consuming is coming from. Because if they're able to make buying decisions based on the fact that they're able to recognize that poorly treated animals have products that are going to give us problems, then they are going to force industry to do the right thing and ensure that poor welfare production systems are a thing of the past. The second point of intervention was looking at the benefits of treating animals better. And interestingly, 2 categories of things came out, although there are 4 of them, there are about 6 results there. A good proportion of us realized that treating animals better is connected to our personal health. And so we talk about 69% of the population were able to identify the fact that when animals are treated better, we end up with better quality meat. About 64% of the population were also able to identify that when animals are treated better, we end up with better health in our families because we are having nutritious, wholesome products that give us no problems at the end of when they're consumed. However, as an organization, being an animal welfare organization, of importance to us is if animals are treated better, then animals have a better life, what we are considering as high welfare. And it's good to note that 69% of the respondents actually said when animals are treated better, it makes their lives better, and animals then are able to enjoy a life that is worth living. In terms of benefits, and just to highlight the differences between those 2 categories, the groups that were able to identify that when animals are treated better, it gives better, the animals then enjoy a better life, were predominantly from the developed world. So countries like Netherlands, Denmark, New Zealand, UK, and Sweden were in that category where treatment of treating farm animals well leads to better lives for the animals. But the developing world were able to identify and connect it to their personal well-being. So Kenya, Thailand, and Indonesia were able to say that when animals are treated better, you end up with better quality meat, for instance. When animals are treated better, you end up with better health in terms, and again, that came through from Kenya, Brazil, Mexico, Thailand, and a bit of also from the developed world, which was very interesting. What then can consumers do? And there are a series of things that consumers looked at. One, consumers can, 79% of the consumers were saying that they would be able to switch to buying high welfare meat. And that then gives the industry the impetus to start looking at high welfare production systems that cater for the animal, because consumers are beginning to say that would like to buy products that are coming from high welfare production systems. 69% said they would refuse to buy meat from retailers that are using products or meat or animals that are not in high welfare production system. And I think therein lies the challenge that we as an organization are going to pick up into the coming years of how then do we differentiate the market so that we can tell this product comes from a high welfare production system and this product comes from a relatively doubtful production system. Some 67% said they would even stop buying products or meat products or products from supermarkets that were not clear in terms of use of antibiotics. And I think those are critical things and valid points that as an organization we want to work with in going into the future. Around that, there were several interesting comments that came out that show that people are beginning to make change if they were given, if the more information was provided. For instance, somebody, if you can look at some of those things, somebody said it gave me a better conscience, I will avoid having meat. One also talked about it, they were not aware of 75% of the antibiotics being used, so they are going to rethink their consumption. And so it shows that there's willingness in the consumer population or in the general public to start looking at animal welfare, especially the welfare of farm animals, critically, because people are beginning to make the connection between production systems and the quality of product and the life that the animal enjoys in that production system. So in conclusion, what did we conclude from that polling? One, there's widespread lack of knowledge. People currently don't know what is going on. For instance, 82% of the population was not able to identify that 75% of the antibiotics you produced annually actually go into farm animals. So that shows that there's need to raise awareness, and that's why as an organization we continue engaging in webinars, on media engagements, in exhibitions, and anywhere where we can raise awareness, working with institutions and academic institutions to drive that agenda. The second thing is that people were shocked when they realized the facts of what is happening in their production systems. 84% of the people think that the risk of the rise of superbug by overusing antibiotics is wrong. 88% are concerned about the possibility of superbugs coming from farm animals. And again, these are things that we then need to start having engagement with industry, with producers, with governments, to see how then the situation can be mitigated around. There was also concern which tends to be driven by personal reasons. The threat of a pandemic of animals is a concern for about 83% of the population. And I think that was driven by the fact that people are now experiencing the COVID pandemic, and they're beginning to realize that certain things would lead to pandemics, and they have a say in that process. And so again, it's a question of how then do we engage with industry and other players to ensure that the situation that is coming from farm animals, especially in intensive farming systems, is managed early enough to ensure that there's no pandemic that comes out. Early this year, we began seeing research and information coming that maybe the next big pandemic will be something around swine influenza. So it's something that we need to start managing our production systems better. There are also concerns around superbugs, the fact that they adversely affect our health, 70% of the population, and 66% saying they contaminate meat. And I think a recent study done by us shows that at certain levels, at the retail level, we need to start looking at how we do certain things, because superbugs has been isolated in previous studies elsewhere, in food that has been bought from the retail end of the production system. And that is a thing that is causing concern and something that we need to start seeing how we minimize. And last but not least, people also realize that there are perceived benefits of treating animals better, which are linked to a better quality product, 69% of the people, and better health from 64% of the people. The other thing that came out that we find is very important is that people think that producers and government need to do more than they're currently doing. Producers need to start looking at systems that are high welfare, that only use antibiotics for treatment of sick animals. And that came from about 85% of the respondents. In terms of government, there is need to start monitoring the use of antibiotics that go into farm animals. And I think it's critical to understand that antibiotics, whether they are being used in farm animals or whether they are being used for treatment of humans, the active molecule is the same. And that is part of the reason why this is becoming a big thing that we need to look at. There's also 90% that consider that, so that government needs to start having laws for minimal farm animal welfare. And so part of what we need to engage and part of what we are engaging as an organization with government is to ensure that minimum farm welfare standards are produced that then cater for the welfare of the animal in the production system. And last but not least, which I think is something that government agencies need to look at critically, is to restrict the use of antibiotics in farm animals, especially antibiotics that have been identified by World Health Organization as antibiotics that are important in the treatment and management of conditions in human health. And that is something that a discussion that is ongoing. When prompted, 28% of the people think that retailers should do something. And there are three things that came out that retailers need to look at. One is 93% are saying that retailers need to ensure that products that are coming from farm animals meet minimum welfare standards. And that, again, is something that we need to work with retailers so that in their procurement process, they have processes that evaluate farms to ensure that only products coming from minimum welfare standards farms or high welfare farms are the ones that come through to the retail sector. There's also need to ensure that only the retailers are only selling meat from animals that are well treated, and it's about having a high welfare production system. And lastly, ensuring that we stop selling meat or products that are coming from animals grown with antibiotics. And those, again, were very critical things, and that the respondents thought that retailers could do. The people themselves also said they were willing to take action. 79% of them were willing to stop purchasing meat from retailers who are using animals, who are using antibiotics to treat animals that are not sick, in a roundabout way, saying that, and retailers that are using antibiotics for growth promotion or prophylaxis. And that is critical because that then would drive industry to do the right thing. Thank you very much. I think that in a nutshell is what we were able to look at. There is more details, and this was just to elicit some discussion. And so I think it's an opportune time to go back to Beth for her to then drive the process around questions and answers and any comments that are coming from the presentation. Thank you.
I realized I was on mute. I'm sorry. Sorry about that. Just I was on mute. Just to say thank you, Dr. Victor, for your presentation. I have learned quite a bit, even just by working with you. And thank you all for your questions. We might not be able to answer every other question just because of time, but we'll endeavor to answer as much as we can. So we'll start with a set of three. The first question is, some people are asking who regulates the use of antibiotics in markets. So we know that overall the government is mandated to regulate, but who is specifically mandated with that action apart from, just down from the government? And alongside that, what regulations have been put in place in the case of, for example, Kenya and other African countries to regulate the use of antibiotics? And the last one, are these regulations, if at all available, are they being implemented, just to ensure we have a reduction in the misuse of antibiotics in farming systems? Thank you.
Thank you, Beth, for those questions. I will start from the top. Who regulates the use of antibiotics in these markets? Traditionally, the use of antibiotics is regulated by the Pharmacy and Poisons Board, and I think each country has a semblance of that. But over the years, what has then come out clearly is that when you put it under the Pharmacy and Poisons Board or under the pharmacist, the challenge has been the use of antibiotics, especially at farm animals. And so in the Kenyan context, what happened about 2015, there was a creation of a veterinary medicines directorate, which then specifically looks at the use of antibiotics at farm levels. And essentially, the two bodies need to work together because we are looking at this thing from a One Health perspective, where you have management of DAWAs at the human level side, management of medication, antibiotics at the veterinary or animal side, and management of the same at the environmental side. So in a nutshell, what we are saying is that it varies from country to country. In some countries, it's a pharmacy and poisons board. In some countries, there's a specific institution, like in the Kenyan context, where there's a veterinary medicines directorate that specifically manages that. And in some countries, it's a mix of the two. So that's essentially that how the antibiotics are regulated. What regulations are in place to regulate the use of antibiotics? Specifically, as I alluded to in the presentation, antibiotics are prescription-only drugs, and regulations are there. If you look at the Kenyan context or in the African context, if you go to the Pharmacy and Poisons Board, there would be regulations of how prescription-only medications are purchased and how they are used and who can use them and who can purchase them and in what for what conditions. The same applies if you go to the veterinary medicines regulations that were done in Kenya for around 2015. You can quickly see where prescription-only medication is sold, who can handle them, and who manages them. I think tied to question 3, which is if the regulations are available, are they being applied? Part of the challenge is that regulations are available, but our management system for these regulations is relatively weak. Hence the reason why a farmer can walk to an agrovet and easily buy a prescription-only medication. I think there's a failure that, and I think what we're trying to say as an organization is and I think listening to what farmers are saying, or the respondents are saying, it is time for government to take these regulatory functions critically and to put their foot down and ensure that medication, especially antibiotics, which are prescription-only medication, are only available on prescription from competent persons who have looked at the case at farm animal level, so that we do not have the rampant use of antibiotics that we are seeing. I would also want to say that there are several African countries who are trying, and for those who have traveled around, there are places where you cannot go to a pharmacist or a chemist and buy antibiotics without a prescription. I think it's a challenge in the Kenyan context, and I think the other East African countries fall in the same category, for us to start saying antibiotics, whether it's for human use or for animal use, must be only when there's a prescription after a diagnosis has been made by a competent medical personnel or veterinary animal health practitioner. Thank you.
All right, Victor, thank you for that. I believe you have exhaustively answered that. Some participants have taken us back and they are asking, what are superbugs? You know, throughout the presentation, you kept saying superbugs and some people are floating. So you could clarify what superbugs are. And another participant has asked how many respondents in Kenya were interviewed for this poll. And the other questions is when we talk about the misuse of antibiotics, generally, are antibiotics harmful or helpful to animals? Thank you.
Thank you, Beth. Sorry for that. I assumed that everybody knew superbugs. My bad. Superbugs are essentially any organism that is resistant to drugs that are used to treat it. In this particular presentation, we've restricted ourselves to antibiotics and talked about superbugs in relation to organisms that are resistant to antibiotics. And it can be an organism that is resistant to 1 antibiotic, 2 antibiotics, 3 antibiotics, 4 antibiotics, what we are now calling a multi-drug resistant organism. But as I said, it's not restricted to antibiotics only. We have superbugs that are resistant to antifungals. We have superbugs that are resistant to antihelminthics. So it goes to which organism and what is it resistant to. But essentially, it's organisms that are resistant to the chemicals that we are using for treating them. And that means that when you get infected by them, treatment or management of that condition becomes very hard. And as we've said, in terms of antibiotics, the world now is losing close to 700,000 people annually because they have been infected by bacteria that can no longer be treated by the known antibiotics that are available. Hence the importance and why we are looking at it. In terms of how many respondents, when at the beginning I said that the poll was done across 15 countries, which are where World Animal Protection has regional offices. And in each of those countries, we had 1,000 respondents, hence the total coming to roughly about 15,700 people across the 15 countries. Are antibiotics harmful? A good question. Antibiotics, let's start by saying that antibiotics are chemicals that can be useful and can also be harmful. Hence the reason why they are considered poisons at certain levels. If misused, they become poisonous. Yeah, and the aspect we are looking at now is where antibiotics are being used wrongly and they're ending up in the food chain. And the way they end up in that food chain is two things. Either one, they end up as residues in the product. So you have milk that has antibiotic residues, or you have milk that has a low level of antibiotics, which when you consume, means that you're consuming antibiotics at subtherapeutic doses, low doses that are just going to select organisms that you have in your body, the normal organism. The second thing is when they're used in haphazardly or wrongly in the farming system, what happens is they select out. So they will kill out the good bacteria or bacteria that are susceptible to the chemical and leave out those that are resistant. And that is part of the big challenge of superbugs, that because you're using them at farm level, what essentially happens is we select out organisms that are resistant to that chemical or that antibiotic, and that then ends up on your plate as food or part of your food, which then means that the organisms that are coming from that food end up with transmitting the resistant gene to the normal organisms or the organisms that are in your body or you are exposed to. And that then leads to a situation where when that causes a disease, then it's not easily manageable. And that's the reason why we are saying it is important to have high welfare production systems that then negate the use of antibiotics. That means you then don't have antibiotics in your food or antibiotic residues in your food or antibiotic resistant organisms or superbugs in your food. So it's a thin line between whether antibiotics are harmful and the usefulness of those antibiotics. But I hope that clarifies the issue.
All right, thank you. Thank you, Victor. We'll move to the second last set of the questions. Someone is asking, what has really driven us to the point where, antibiotics are being used as growth promoters in the farming systems? What has really led to that point? And the other question is, how can we increase animal welfare while ensuring food security? And the other one is, where should we start in farming systems to reduce the misuse of antibiotics? So it largely seems like we have almost gone overboard with the use of antibiotics in farming systems. So if we are to move back, if we are to start to make things right, what would be the best place to start?
Thank you for those three questions, and I think they are all interrelated. I'll try to answer them as clear as possible. What is driving the use of antibiotics leading to them being used as growth promoters? I think what happened is what is driving the use of antibiotics is essentially the fact that we have a growing global population that needs to be fed. in the last estimates, around 2015, we were about 7 billion people, and it's estimated by 2050 will be about 9 billion people. And the biggest growth of that population will be in Africa, where we will literally double in the next 35 years. Yeah. So that is what is, how do we then feed this population and feed them in a holistic, nutritious, balanced diet? And that's part of the challenge. So part of then what has happened is that people then started intensifying farming. So we came from free running, open cuckoos to where we are now beginning to put animals in big houses, feed them. We feed them with the feed that they require and intensify that production. I think what then happened is people quickly then discovered that when animals are brought together and in an intensive production system, you are prone to diseases. And for you to then be able to manage that disease process is where prophylaxis then came. So if you put the antibiotics slightly earlier or around the times that affect that the animal is going to have problems, then you are able to go over that problem. At that point, what people failed to see was that by doing that, you have a better growth rate, you have quote unquote better, higher productivity, but essentially you have introduced a foreign chemical into the food chain that then is now leading to antibiotic resistance and is harming the human population because you are ending up with antibiotics in food, you're ending up with antibiotic resistant organisms in food. And I think that's what led to Europe making a decision in 2006 to ban the use of antibiotics as growth promoters, because clearly they could see the consequence of what was happening in the human population. And then, and the other thing we must also be aware is the fact that the antibiotics that are being used, the active ingredient is the same, whether it is human or whether it's for farm animals. And that's part of the connection that people then led to that. The fact is also that it's closely related to the second question. If you then manage your animal welfare properly, then you might need not have to put antibiotics into the production system. And when I'm saying this, I'm saying we need to then go back and look at the 5 fundamental freedoms around which animal production is driven. The freedoms are about 1, freedom from hunger and thirst, which essentially is if you give the animal good quality feed and good clean water, then there's no need to put antibiotics because the animal will be robust, will be growing at a good rate, and will be producing good quality products. If you give the animal adequate space, and I think people are now beginning to appreciate the need for space, especially after people being told about social distancing. If people are too closely compacted, disease progression through the system is very easy. And the same thing, if the animals are packed tightly into some enclosed spaces, diseases do occur, and that's one of the reasons why we are now looking at stocking density and saying maybe we need to reduce our stocking density. In fact, Europe is moving away. If you look at chickens, they're moving away from 40 kilograms per meter squared back to where Africa is, which is about 30 kilograms per meter squared. The challenge we are having as an organization is in the African context, Africa is trying to move into the big so-called factory farms, which might bring us more problems that we think that in terms of food security. So maybe we are at the optimal place that we need to be for our naturally ventilated chicken houses. And maybe it's time for us to consolidate and say, how then do we manage our production system to ensure that the animal is producing optimally? And that part of that is ensuring that the our animal welfare needs are catered for. So space is another one, or the environment is another one. There's also the freedom around ensuring that animals have no pain, injury, or disease. Yeah, which means you have a good biosecurity system. The house is clean and cleaned out properly between the 2 flocks or between batches of the piglets. You ensure that the animals are vaccinated and vaccinated properly so that there's no disease spreading through the system. And that helps in improving productivity. So essentially what you're saying is a happy animal, an animal whose welfare is catered for, tends to produce better, and also tends to produce good quality products. And that is closely linked to food safety and food security. And I think our extension message going out there from producers from government to small-scale farmers that we work with, to anybody in industry, is that let's do the right thing. Let's cater for the animals' needs. Once we do that, then the animal will produce optimally, and we will be able to contribute towards our food safety and our food security requirements. The last question is about how then should we start to reduce the use of antibiotics? And it's again closely linked to what I've been talking about in terms of catering for the needs of the animals. In this country, and I have worked with industry for almost the last 25 years, there are people and big-scale farmers who are able to produce without using antibiotics unless it is necessary. Remember that as an organization, we are not talking about antibiotic-free production. We are talking about production that caters for the animal. And part of that is if the animals fall sick, then they need to be treated. But I know farmers, chicken farmers, pig farmers in this country that are able to produce without using antibiotics by simply adhering to good husbandry and good disease control systems, ensuring that the production system is biosecure, ensuring the production system is hygienically clean, ensuring that the production system is well ventilated, that the animal is getting good quality feed, that the animal is getting good water, that the animal is properly vaccinated so that there's no disease coming from outside, that the animal has enough space to exhibit its natural behavior, and that the animal is having no fear and no stress. That production system will minimize the use of antibiotics. And it's something that has been done and is also ongoing, even in this country where we are.
All right, thank you, Victor, for that. We'll move to the last set of questions, after which we will finalize the main session and move to the journalist section. So the question is, what is World Animal Protection doing about the current state of the use of antibiotics in the market? So for example, is World Animal Protection closely working with industry to ensure improved standards? We have talked about the connection between misuse of antibiotics and human health. Are we working with the health sector to on this? And lastly, are we closely working with government as well to support them on the area of regulations, to improve the regulations or create regulations if none? And finally, what can consumers do? Everyone who has attended this is a consumer. So how can they make better decisions? How can they tell if the product they're buying has come from a high welfare system or not? And generally, what can they do to ensure there's a spread of awareness of this information? Thank you.
Thank you, Beth. I think those are good questions to then conclude with. The easier one is what World Animal Protection is doing in terms of antibiotics and the link between antibiotic use and farm animal welfare. As an organization, we've been working with industry and predominantly the chicken and the poultry and pig industry to look at industry standards and to look at the production system. How do we make it a high welfare production system that caters for the needs of the animal? And so we have engaged the poultry industry in this country, and especially, essentially in this region, because we are working with the poultry industry in Kenya, Uganda, and Tanzania, and a bit of Zambia. And the idea has been, if the poultry industry and the pig industry are able to self-regulate and identify some of these things that are not only going to negatively impact on their bottom line, but are also negatively going to impact on their performance, because a poor an animal in poor welfare underperforms and underachieves. And these are big organizations that are looking at the bottom line, so to speak. So that's one level. So we have engaged them in terms of looking at their production system, working with their farmers and their producers to ensure that they have the right information in terms of the requirements and animal welfare, working with them to enlighten their producers, their farmers, their contract farmers, whoever they're working with, to ensure that they understand the nexus or the connection between animal welfare and higher productivity. So we are currently engaged with producers. And producers, when I talk about producers, it's not only the big producers, but as I said, how then do we work with them into their production system? How do we work with the farmers that they work with? And I think some of them have given us very good opportunities to then interact with the farmers and give more information. We also engage with government, and part of what we've been doing, if you look at this country, we have been working with government to develop the appropriate legislation. Currently, there's an animal welfare and protection bill that is going through the legislative process. That World Animal Protection was part of the team that looked at it, because it was reviewing CAP 360, the Animal Protection to Cruelty Act that looks after animal welfare. And so that's part of the process that we've done. We're also working with the government, and at the regional level, we are working with the African Union and we are part of the team that helped the African Union to develop the Animal Welfare Strategy for Africa, which is the big document around which animal welfare is going to be catered for. That document has a lot of inputs around farm animals and the welfare of farm animals, because the African Union recognizes the critical role that livestock plays in the livelihoods and food safety of the African people. And so that's part of what we've been doing. We've worked with countries, several countries, to try and develop national animal welfare strategies or animal welfare policies. And that is something that is going to help in the legislative agenda and ensuring that we have the right regulations in place to ensure that the welfare of animals in production systems is catered for. Beyond that, if I can come to the Kenyan context, we were part of the process that then looked at the development of the national policy and national action plan for the reduction of antimicrobial resistance. And so in 2017, we were part of the team that saw the birthing of the animal welfare, the policy around reduction of antimicrobial resistance. And it's something that we are currently engaged in, because it's not just about developing policies, it's also about, once the policy has been developed, how is it been implemented? The national policy for reduction of antimicrobial resistance has an action plan. And part of what we are doing today, raising awareness, is part of the action plan that is ingrained in that document. At the continental level, we are looking at working with other countries to develop the national antimicrobial resistance reduction policies and also action plans, so that the process can be moved to some other countries, not only restricted to the East African countries. So there's a lot of work that World Animal Protection is doing in terms of engaging government and ensuring that the right information is going through. At county level, if you look at counties like Kenya, we are working with the various stakeholders at county level to raise awareness around animal welfare at farm level, in things like exhibition, in things like farmer trainings. And that is something that is critical, because the more awareness is driven, the more the consumer is educated, the more the public is aware of dangers of antimicrobial resistance or superbugs, then the better they will be able to make buying decisions. We're also working with other players, and I think one of the players we're also working with under the umbrella of the National Action Plan and the policy around reduction of antimicrobial resistance is engagement with in what would loosely be called a One Health Forum, where we are listening to what is coming from the medical world, we are listening to what is coming from the environmentalists. As an organization, we are even going to be looking at doing a research piece that will be looking at how, the connection between farming or big farms. Are they releasing organisms that are then contaminating the environment or the waterway? So we are working with research institutions to generate African data that then helps policymakers to make better decisions and informed decisions on what needs to happen in terms of reducing antimicrobial resistance. What can consumers do? I think the big thing is consumers need to know where their food comes from and the processes around the animal proteins that they end up there on their table. If the animal is not catered for, you end up with a poor quality product that could be harmful to your health. And I like the way it was couched in the results that came from the poll. The poll quickly, so the consumers began to recognize the fact that animal welfare is closely linked to the consumer's health and the welfare of the consumer. And that is an important thing that we need to be driving, so that when we are going to buy our meats or our milk or our eggs, whatever point we are buying them from, whether it's the local retailer or whether it's the international retailers, we need to be asking them the hard questions. Where is this food coming from? Have you ensured that there's no antibiotics? Is the animal cattered? So that you can quickly make a buying decision, and buying decisions then push industry to do the right thing. And so essentially it's about raising awareness. For those of us who've been with us today, you have learned one or two things. If you share it with your neighbors, share it in the WhatsApp group you are in, share it in the social or digital space that you occupy, you are then helping to raise awareness. And by doing that, you are helping to ensure that the animals that are part of our ecosystem and part of what we use for our food are also catered for, and those animals are then able to live a life that is worth living. Thank you.
All right. Thank you, Victor, for really answering all the questions in detail. If your question did not get to be answered in this session, as you can see, we are way over our time. We will endeavor to do so after this webinar through the email that you registered the webinar from. Now, just to share the poll results for the first poll we did at the beginning. 21% of you said that 26,000 tons are used of antibiotics are used in farm animals. Others said 250,000, which is 68%, and the others said 14%. The correct statistic is actually 131,000 antibiotics are used in farm animals. And then the other question was, how many people die from drug resistance every year? The current number is 700,000, where 39% of you, said that. Yeah, so you are correct that 700,000 people die every year from drug resistance. So you can already see how extensive this whole problem of antibiotics resistance is. Thank you all for attending this webinar. If you are new to our webinars, thank you so much and welcome, and please do attend our next webinars. For those of you who are returning, we thank you for sticking with us and for continuing to support our webinars. This is the 7th webinar since we started our series of webinars this year, and we thank you all for making the time to attend. We'll now move to the journalist session. So if you're a journalist and you're representing any media house, or if you barely needed to ask your question verbally, kindly stick around and it will give you an opportunity to ask your question to Victor. But before we finally close this main session, I'd like to put up a poll just to gauge how your experience was in this webinar. Kindly take the time to participate. We are now officially in the journalist session. If you're representing any media house, kindly raise your hand and we'll give you an opportunity to verbally ask your questions to Victor. I'll give you a moment just to raise your hand, think through your question, and raise your hand if you have any question to ask. All right, we'll start with Sharon. Sharon Atieno. Kindly tell us which media house you're representing and then go ahead to ask your question. Sharon Atieno. Looks like they were not prepared. Nuru Sadun, please tell us which media house you're representing and then go ahead to ask your question.
Hi there.
Hello, hi Nuru.
Yeah, I'm Nur Sadun Ahmed, science journalist at Science Africa in Nairobi. And my question is, it's like, let me say it's a comment and it will come in as a question. Some products are made from plastics, e.g., when I was in Kampala, there were some Chinese making some plastic eggs in Kawempe, but they were got hold of. And there are some rumors saying they are plastic chicken and fish. How is this dangerous to human life, as maybe all these things contain many antibiotics? So how safe are we? Or we should just go vegetarian? Thank you.
All right, anyone else with a question? I can see we don't have any hands up. Okay, maybe Victor, you can answer that as we wait for others to raise their hand.
Thank you, Beth, and thank you, Nuru, for that question. Very interesting. I would want to say that I'm not very conversant with plastic chicken and fish. I know there is things around artificial production, and that is where the world is headed to. Because if you look at the limitation of space, they are slowly beginning to say maybe we don't have enough space to grow enough animals and plants for consumption. And I think that is something that we need to have a discussion around. And so there's been production of artificial foods, so to speak. I know in the developed world, there's been production of artificial meat. For journalists like scientific journalists like Nuru, if you Google clean meats, you'll find that there's been a lot of work done around artificially producing meat or milk in a lab. And that is a discussion we need to have, especially because of the intensification of farming and the conflict between farming and the space that's available. And if you look at the Kenyan context, we are now moving into spaces which were predominantly wildlife. Recently, I read in a newspaper that somebody had bought land next to Amboseli to grow avocados, and it was going to cause a conflict because that was the elephant pathway. And so that is something that we need to discuss. Question then we need to ask ourselves, are these things nutritive? I think it depends on what they are and how they are produced. I've also heard about plastic chicken and plastic fish. As far as I am concerned, that would be very artificial. They would be of no nutritive value to you because plastic has no nutritive value as far as I'm aware. But I think it then behoves our regulators to start looking at up on these things. If I'm going to produce meat or milk artificially, is there a standard or is there a process around which that the regulators, Kenya Bureau of Standards, Uganda Bureau of Standards, TBS in Tanzania, have put in place? If you're going to use genetically modified organisms, are they biosafe? And I think those are things that regulators need to start looking at. And that's how I'd like to answer that. But the reality is that they are slowly is beginning to see production at another level. And maybe that's why as an organization, we are moving into food systems. And food system is looking at the whole system from the farm to when you eat that product. Is it safe? Is it being produced in a way that does not harm the environment? Is it being produced in a sustainable way? Is it being produced in a way that ensures that if animals are used, their needs are catered for? Thank you.
All right, thank you, Victor. Okay. Nuru, do you have another question?
No, thank you, Victor.
Okay,
And
all right.
yeah.
Yeah, so looks like most people asked their questions through the main session. So we all last minute. Ryan Jack, Ryan. Someone just raised their hand, but they have not asked their question. I think this will be a good place to conclude. In case you have any questions and you've not had an opportunity to ask for your stories later today, kindly write to our colleague Evans Kipkorir at worldanimalprotection.org, and he will support you with any questions that you might have in regards to media. So we've come to the end of this webinar. Thank you for your time. Thank you for attending, and we hope to see you in the next webinar. For now, goodbye and have a great weekend. I think it's fair enough to say a great weekend on Thursday. All right, thank you so much.